Hello everyone. Now I'll be discussing question of neurology. So we have a 78-year-old man who has a recurrent fall. He lost his balance and fallen several times over the last 6 months. And they also noticed some shaking of his right hand. Patient take amlodipine for hypertension, lansoprazole for heartburns, and his BP is fairly well controlled. And CNS examination revealed mild rigidity of the limb, muscle, and shuffling gait. Well, if you get this word in any question, shuffling gait, perhaps you are dealing with Parkinson. It's a golden line to remember, and I always tell that there are few keywords which are really suggestive, which are getting a pinpointing toward the answer. Anyway, now the side effect may be expected early when the initiation of levodopa carbidopa therapy. Oh, now he has made very clear, and we are well aware the levodopa carbidopa we give for Parkinson, right? But now the question is different. He's asking what is the early side effect that we expect in this. Okay, very tricky question. Not only he is asking side effect, earlier side effect, which one of the following is there? Well, answer is hallucination. Well, as I told you, this patient is most likely suffering from Parkinson, that I told you, by rigidness and some tremor and shuffling gait, the classical thing. Symptomatic therapy should be started because this symptom compromise with his daily activity of life. Okay, so that's why they need to be treated early. Now, what are the agents which are available or drugs which are available? Levodopa carbidopa combination, dopamine agonists, anticholinergic and amantadine are the commonly used drugs. After this, levodopa carbidopa is the most effective symptomatic treatment. Its beneficial effect on all the features of Parkinson, although it does not stop progression of the disease. Why? Because this Parkinson is a neurodegenerative disorder. And that's why this progression cannot be stopped. Well, when we are using carbidopa, the early side effects include nausea, hallucination, confusion, agitation, dizziness, and somnolence are the common early side effect. And you find hallucination, which is also answer this question. Now, involuntary movement. Dyskinesia, dystonia typically occur after 5 to 10 years of therapy. Okay, and they may be occur in around 50% of the patient taking carbidopa, levodopa, but that occurs after 5 to 10 years, very late. As a result, it is important to find lowest therapeutic dose so that these side effects are delayed and do not occur or to occur to the minimal level. Now, as I told you in the previous slide also, this choreoform acidosis is a late side effect and more commonly seen earlier with catechol O methyltransferase, so-called COMT inhibitor. Now, a question for you. Stop the video, write down the answer. Name any drug which is a COMT inhibitor. Write down. Well, the answer of the COMT inhibitor are tolcapone, anticapone, now levodo-radicalis. This is a motor vascular pattern in the lower extremities and is very commonly seen with amantadine therapy. it is usually not seen. Levodopa reticularis is usually not seen with levodopa carbidopa. Well, this is classical. You can look into this. You cannot miss this finding. Well, urine retention. This is most commonly seen with anticholinergic drug. Like benztropine. Well, when we are using anticholinergic, they really improve tremor and rigidity well, but they don't have much effect in the bradykinase here. Now, urine retention is the problem when we use drug like anticholinergic. Now, stop the video, write down the answer. This is due to which nerve is affected in urinary bladder, which will lead to urine retention. Write down the answer in your copy. Okay. Which nerve is getting involved? Well, the right answer is pelvic nerve. It is a parasympathetic nerve, and that is definitely this drug, anticholinergic drug, are going to block, and that lead to urine retention. Remember, it is this nerve which really causes bladder contraction, or detrusor muscle contraction is done by this nerve. So, golden line to remember: most effective symptomatic therapy for Parkinson is levodopa carbidopa. The early side effects are hallucination, dizziness, headache, agitation. After several years of therapy, coliform, dyskinesia, involuntary movement are likely to occur. Now, let me give you a summary of the various anti-Parkinson drug and the side effect. Well, levodopa carbidopa is a dopamine precursor. Mechanism of action, side effects: somnolence, confusion, hallucination, and dyskinesia. Trihexyphenidyl or benztropine is an anticholinergic drug. Dry mouth, blurred vision, constipation, nausea, urine retention are the side effect. Amantadine mechanism is usually, they said, are not clear, but side effects are ankle edema, very commonly asked question, and livedo reticularis. Well, I have one more question for you. Stop the video, write down the answer. Ankle edema is commonly seen with the therapy of any cardiology drug other than beta blocker. Forget beta blocker. Any other drug you know of which can lead to ankle edema. Stop the video, write down the answer. Well, it's a drug that we use in hypertension. Yes, it is nifedipine. Of course, we can say calcium channel blocker, but it is very commonly seen in nifedipine or amlodipine also. Well, we come back: apomorphine, bromocriptine, pramipexole, or ropinirole, they are dopamine agonists. Somnolence, hypotension, and confusion, hallucination may occur in the older patients. Entacapone or tolcapone, which I told you, they are a COMT inhibitor. Dyskinesia, hallucination, very common in this, and orthostatic hypotension. Sertraline is a MAO-B inhibitor, insomnia, confusion. Okay. Well, again, one more question for you. Stop the video, write down the answer. Suppose you are prescribing MAO-B inhibitor to any patient. Which special instruction you will give the patient regarding diet, that he should be very careful about the diet? Stop the video, write down the answer. Well, you advise him not to take cheese. Okay. Because it may precipitate severe hypertension in these patients. So, diet, no cheese. Thank you very much.